Hi, this is Dr. Tom Rogers at Performance Medicine. Welcome to the Christmas season. You see the tree in the background. I hope you're having a wonderful holiday season, despite being a tough year of 2020, year of COVID. I'm hoping 2021 will be better for everybody. I'm very optimistic that it will be. Today we're going to talk about how to sit, stand, and walk. We're going to talk about your posture. Really, in my experience, people come to the doctor for one of two reasons, unless it's for routine physical or virus or something or cold. Or it's really because they either hurt, they're in pain, or they're tired. So we're going to talk today about one reason for that hurting, especially as you get older. It's really related to your posture. We're going to talk about fascia, which is that membranous lining below your skin all the way down to every cell. It's like what surrounds every cell in your body. You know, we're used to kind of compartmentalizing different organs like your liver, your kidney, your heart. And the fact is they all are separated by this fascia or connective tissue. And you know, we don't really think about that connective tissue a lot, but the fact is it's all interconnected. So all that fascia in your body, the part of tissue that connects everything from your head to your toes, is actually one big membranous structure. It's all connected, and one part can affect the other. And really it's imbalance of these connective tissues that lead to pain and really some chronic debilities. Gravity has an effect as well, because that connective tissue can become stiff and hard as you age. And stress and dehydration, i.e. not drinking enough water, makes it even worse. So, you know, at 65 years old, I'm feeling it every day. And I'm doing everything I can to battle it. All the way from trying to drink more water to taking as many natural anti-inflammatories as I can, to stretching, doing yoga. You know about my infrared sauna that I love. But the fact is I've had poor posture most of my life. And I also have had poor sleeping positions, which I'm convinced is why I have a lot of problems with my shoulder and probably my back. You know, I've experimented with different kinds of beds, shoes, stretches, all kinds of exercises. And what we're all looking for is to have that loose, pliable body. So I'm going to give you a few tips on how to sit, stand, and actually move around. Because if you observe people when they sit, stand, and move, you can learn a lot about how they feel. And most of them are in pain, especially as they get older. You know, when you're a kid, when you're a baby, you know, it's very hard to get sore because your body is so loose and it's covered by so much fat, and your bones are soft and mobile. As you get older, everything kind of stiffens up and you get kind of calcified. That's what we're trying to prevent. That's one reason I take EDTA, to kind of resorb some of that calcification. And as you know, I do take a lot of supplements to kind of keep my body uninflamed. Inflammation causes stiffness and causes almost every disease out there. So that connective tissue and how your posture is, you know, affects everything. Think about it. If you're slumping over, and I'm purposely trying to sit straight today, and I'm trying to be aware of where my body is in space, that proprioception that we all talk about, because it's important. So when you talk about the body in space, we're talking about how you feel from the top of your head to your vision, all the way down to, are you feeling your feet and your toes touch the ground? So I'm trying to sit up straight. I'm actually, as far as sitting goes, you need to, you don't want to slump in a chair. Sitting in a chair has really been recognized as almost as dangerous as smoking nowadays. Well, you've heard sitting's the new smoking. But when you're sitting back and slumped back in a chair, sitting all on your buttocks, you're really setting your body up for a lot of pain. One of the worst chairs is your car seat because it's made to where you don't move at all. And as gosh, when I drive to Knoxville to my office there, I get out of the car after an hour and 45 minutes, 2 hours. I'm really stiff. My hip flexors are tight. So one of the worst things is chairs. So really, when you pick a chair, you want kind of an ergonomic chair. Even when you have a back support, you don't really want to use that back support. You want a chair that makes sure your thighs are kind of pointing downward and both feet are on the ground and you're actually feeling that ground. A lot of your weight, probably 40% of it, should be on your thighs, not your buttocks. Think about it. I mean, when you're slouched back in a chair or sofa and you're way back like that, it affects your digestion because it cramps up your bowels. It also affects your breathing, that diaphragmatic breathing you're supposed to do instead of upper airway chest breathing. It limits the flow of that diaphragm up and down that you're supposed to get all the good breathing and relaxation from. So when you sit, try to sit from in a forward position, a pelvic leaning forward position with a lot of your weight on that legs. As you know, most people work with a lot of computers. Everything we do is forward moving, so we ignore the backside of our bodies, which is actually the most important. And it leads to a lot of chronic debility, pain, and soreness. So you want to sit forward, legs planted on the ground. And the other thing, you don't want to sit for too long. You want to get up and move around. You might even want to get a small pad for you to sit on where you can have this micro movement. You're actually kind of moving a little bit, very subtle movements that keep your circulation going a lot. So I like a little pad in the chair as well that you actually move a little bit around on, whether it be a thin piece of foam or whatever. I think it's good. That's why a lot of people actually bring these Swiss balls to their offices and they actually sit on a ball, a big rubber soft ball. But I prefer a chair, and I like people that have these standing desks because they can get up and actually walk around a little bit. But so when you're sitting at a desk, please get up every half hour, every 45 minutes, and move around, and don't just walk around. You should actually kind of dance, move your arms and your legs and keep everything open and loose. Just don't walk around the room and back. Actually, it's kind of embarrassing, but actually kind of dance a little bit. In my mind, dancers are some of the best athletes in the world. I mean, they are so flexible and so lean and muscular. Dancing gets every part of your body. When you run or cycle or do a lot of these other exercises or lift weights in one dimension, you're really not doing your body what it's supposed to be doing. We were meant to move everywhere in nature. We weren't meant to be limited. So think about the way you sit, take breaks, sit forward. A lot of the pressure should be on your thighs, and you should have kind of a forward-looking position with your kind of butt tilted back and your chest out and your head as up as you can and roll around a little bit. We get sore in our traps a lot. Some professions are really horrible for it, like where you have to stand up and be hunched over, a patient like dentists. All my dentist friends have sore necks. I talked to Rick Bateman about this a lot. It's nice to have somebody in your office that can massage your neck occasionally. Rick, I think that'd be a good present for all your girls for Christmas is to hire your own in-office massage therapist for medical massage. And I really learned about fascia through my massage therapist who does a lot of fascia release things on me. And actually, I got turned on to this Theragun for that purpose. It's really cool. I'll show you how this thing kind of works. It's great for See that? Isn't that cool? It's great for kind of massaging yourself. It's especially good for tight IT bands and calves and quads and your lower back muscles. And this has been one of the best tools I've gotten in years. It's called the Theragun. So I just love it. But anyway, let's look at a couple other things. Another thing is I love to, I talked about dancing. Bouncing is actually good for you. It's not only good for your tissues and your fascia, it's really good for lymphatic flow too. And as you remember, you have a lot more lymph fluid in your body than you do blood. So think about the rebounder. I've talked about that several times. I like to rebound about every day for about 10 or 15 minutes. Great exercise. I rarely ever, I never run anymore. I'm too old for it. It's just too hard on my body. I love to bike, but I love to stretch and do yoga and do all body movements. Actually, it's funny because your bones are actually meant to float inside that fascial layering of your body. You don't want your body being as stiff like a brick house that doesn't move. Structures like bridges and these buildings made of steel are actually made to bend, especially the tall ones. They actually give and they move. Your body's the same way. Your bones move around. That's why they have joints. Your bones are meant to move. When they start getting stiff, you're in trouble. And that's what we're trying to reverse. So sitting is actually harder for men just because of some of the anatomy than women. They tend to have smaller backsides, and it's a little harder for them. One good exercise is just to sit in the floor, and that allows you to open up those hip flexors. So do that. Now, standing, you should stand like you're balancing something on top of your head. A lot of times if you see old people walk around, they're kind of walking around with their neck craned forward, and sometimes they have to put their hands behind their back just to balance. So, and at that time they're really getting weak in their buttocks and hip flexors, and a lot of your strength comes from the lower part of your body. So, and that's how you motor around. That's how you get up from a chair, how you stand up. So you need good posture so where you're not slumping over all the time. So think about that. You should have your butt out, shoulders back, and head tall. I like to watch people walk around that look kind of cocky because they're moving about everything. They're not so stiff. Look at some of your sprinters, the way they walk around the track or just around in everywhere. They're really loose, and they usually have great posture. They're very aware of their muscles and their bones. And remember, it's all connected by this fascial layering that we never even think about. Anyway, so sitting, standing, and walking. Never skimp on your shoes or your mattress. You're going to spend most of your life in one or the other. Move around a lot. Make sure your body's flexible. It's all about balance. And as Ernie Dixon will tell you, the famous physical therapist, whenever he evaluates somebody for injuries, he always evaluates their posture and the way they're symmetrical. Symmetry is beauty. Same thing with the whole human body. If one thing gets out of line, like one shoulder or one hip, the compensatory reaction is going to be bad for the other side, and you're going to just move from one hurting part of your body to the other. So think about this. Feel from your eyes, your head, down to your toes, and learn how. Be aware of your posture. Think about doing those things that will help you loosen up all that fascia. That's why I like moving water with, jet tubs and hot tubs and water moving against your body. Do everything you can to stay loose, and especially this Christmas season. So hope that helps. I'll see you next week.